Preparing for pregnancy when you have diabetes. Pregnancy and diabetes doesn't have to be a risky combination. By preparing for pregnancy, you can boost the odds of delivering a healthy baby. Here's how. If you have diabetes, either type 1 or type 2, and you're thinking about having a baby, you might be concerned about the risks. To put your mind at ease, start preparing. Controlling your blood sugar level and making healthy lifestyle choices before pregnancy can help you give your baby the healthiest start. Start with a checkup. The first step in preparing for pregnancy is to talk to your healthcare provider. He or she might recommend changing medications. If you take oral diabetes medication, you might need to switch to insulin or make other changes to your diabetes treatment plan before you conceive. In addition, some medications, including certain drugs to treat high blood pressure, aren't recommended during pregnancy. Treatment for certain conditions. If you have high blood pressure or signs of heart, eye, nerve or kidney disease, or other diabetes complications that could be aggravated by pregnancy, preparing for pregnancy might include treatment before conception. Consulting with specialists. Your healthcare provider might suggest scheduling preconception appointments with an obstetrician who specializes in high-risk pregnancies, a diabetes educator, a registered dietitian or other specialists. Focus on blood sugar control. Controlling your blood sugar level is the best way to prevent diabetes complications. When you're preparing for pregnancy, blood sugar control is more important than ever. Your healthcare provider might want you to reach a specific hemoglobin A1C level, a reflection of your blood sugar level for the past 2 to 3 months, before pregnancy. Your baby's brain, spinal cord, heart and other organs begin forming soon after conception, even before you know you're pregnant. If you have poor blood sugar control during the earliest days of pregnancy, your risk of miscarriage and your baby's risk of birth defects, particularly those affecting the brain, spinal cord and heart, increase. Your healthcare provider will help you establish your target blood sugar range. He or she will also evaluate your diabetes treatment plan and consider any changes that might be needed to improve it. For example, some women preparing for pregnancy might consider using an insulin pump or increasing the number of insulin injections to improve blood sugar control. The goal is to keep your blood sugar level as close to normal as safely possible. Keep up a healthy diet. Your diabetes diet probably includes plenty of fruits, vegetables and whole grains. You can eat the same foods while you're preparing for pregnancy. If you're having trouble keeping your blood sugar level in your target range or you want to lose excess pounds before pregnancy, consult a registered dietitian. He or she can help you customize your diabetes meal plan to meet your pre-pregnancy needs. To help fill any nutritional gaps, take prenatal vitamins that contain folic acid, ideally starting a few months before conception. Get active. Physical activity is another important part of your diabetes treatment plan. During your preconception appointment, get your doctor's okay to exercise. Then choose activities you enjoy, such as walking, swimming or stationary biking, and make them part of your daily routine. Aim for at least 150 minutes a week of moderate aerobic activity, based on Department of Health and Human Services guidelines for exercise during pregnancy. If you haven't been active for a while, start slowly and build up gradually. Remember that physical activity affects blood sugar. Check your blood sugar level before and after any activity, especially if you take insulin. You might need to eat a snack before exercising to help prevent low blood sugar. If you're using an insulin pump, you might need to adjust the basal rate for exercise. Manage stress. When you're preparing for pregnancy, try to keep stress under control. Too much stress can interfere with your blood sugar level and make it harder to take good care of yourself and your baby. Patience pays off. Until your healthcare provider gives you the green light for pregnancy, remember to use a reliable method of birth control. A healthier pregnant how diabetes can affect you and your baby. High blood glucose levels before and during pregnancy can worsen your long-term diabetes problems, such as eye problems, heart disease, and kidney disease. Increase the chance of problems for your baby, such as being born too early, weighing too much, having breathing problems or low blood glucose right after birth, or other health problems. Increase the risk of your baby having birth defects. Increase the risk of losing your baby through miscarriage, which means loss of the baby before 20 weeks, or stillbirth, which means the baby dies in the womb after 20 weeks. However, research has shown that when women with diabetes keep blood glucose levels under control before and during pregnancy, the risk of birth defects is about the same as in babies born to women who don't have diabetes. Glucose in a pregnant woman's blood passes through to the baby. If your blood glucose level is too high during pregnancy, so is your baby's glucose level before birth. After delivery, however, the baby's glucose level may drop quickly and go too low. Having diabetes can also increase your chances of developing the following conditions. Preeclampsia is a condition in which you develop high blood pressure and too much protein in the urine during the second half of pregnancy. This condition can cause serious problems for you and your baby that can be life-threatening. The only cure for preeclampsia is to give birth. If you develop preeclampsia late in your pregnancy, you may need to have surgery, called a cesarean section, or C-section, to deliver your baby early. If you develop preeclampsia earlier, you may need bed rest and medicines, or you may have to be hospitalized, to allow your baby to develop as much as possible before delivery. Depression can make you too tired to manage your diabetes and care for your baby. If during or after your pregnancy you feel anxious, sad, or unable to cope with the changes you are facing, talk with your doctor. Depression is a treatable illness. Your doctor can suggest ways you can get help and support. Your diabetes, before and during your pregnancy. As you know, in diabetes, blood glucose levels are above normal. Whether you have type 1 or type 2 diabetes, you can manage your blood glucose levels and lower the risk of health problems. A baby's brain, heart, kidneys, and lungs form during the first 8 weeks of pregnancy. High blood glucose levels are especially harmful during this early stage. Yet many women don't realize they're pregnant until 5 or 6 weeks after conception. To protect your baby's health, work with your healthcare team to get your blood glucose under control before you get pregnant. If you are already pregnant, see your doctor as soon as possible to make a plan for taking care of yourself and your baby. Even if you learn you're pregnant later in your pregnancy, you can still do a lot for your health and your baby's health. Planning ahead. Before you get pregnant, talk with your doctor about having a baby. Your doctor can help you make sure your blood glucose levels are on target and give you the care and information you need to prepare for pregnancy. If you are thinking about getting pregnant, you can take these steps. If you have questions or worries, discuss them with your healthcare team. If you're overweight, talk with your doctor about losing extra weight before you get pregnant. If you're not ready for pregnancy, talk with your doctor about how to delay getting pregnant until you are ready. My blood glucose levels. Daily blood glucose levels before pregnancy. If you are thinking about getting pregnant, Talk with your doctor about what your blood glucose targets should be as you get ready to have a baby. Find out when and how often you should check your daily blood glucose levels with a blood glucose meter. If you already check your blood glucose levels, you may need to check them more often than you do now. The following chart shows target blood glucose numbers for women with diabetes who are planning to become pregnant. Target blood glucose numbers, mg, dl, for women with diabetes planning to become pregnant. Before meals and when you wake up 80 to 110 and 1 to 2 hours after reading -100 to 155.